Welcome to the Expedition Chiropractic podcast, where your spine embarks on an adventure toward better health. Hosted by Dr. Stephen Barger, your severe spine specialist, we offer expert Gonstead chiropractic care right here in Port St. Lucie, Florida, serving the entire Treasure Coast. Whether your back has taken an unexpected detour or just needs a tune-up, you're in the right place. Let's get started.
Joint pain can slow you down, but chiropractic care might be the key to finding relief without surgery or medication. Hello, I'm Millie M., co-host producer, back in the studio with Dr. Stephen Barger of Expedition Chiropractic. Dr. Barger, how's it going?
Doing great. How are you today?
Doing quite well. So joint pain is something that many people struggle with. I'm excited to dive into how chiropractic care can make a real difference. So can chiropractic treatments help with joint pain?
Yes. So there's lots of different joints that we can help with outside of the spine. So most people think of chiropractic, they're going to think neck, mid-back, low back type symptoms. But really that's the foundation of your health is going to be your nervous system that sits inside that. But we can also help your shoulders, your elbows, and your wrists and stuff like that. One of the most common things that we'll first see is people that come in with like shoulder pain. A lot of times people will think they have a tear in the rotator cuff or something like that. And then we have to trace the origin of that. It could be coming from the spine itself. It could be coming from the shoulder blade, or it could be coming from the shoulder itself, depending on what their symptoms are, where are they having pain, and what can we do with that. So shoulders are going to be very common, but then we also have to work our way down and see, is the elbow getting affected as well? So a very common thing we'll see, we call it like a tennis elbow injury. So this is an overuse injury that you get from gripping things. So commonly it's used with tennis players, what's called tennis elbow. But it's mostly, I'll see it in general population as just like, I was picking up my luggage and tried to put it in the overhead bin and I strained the muscles in my arm right here. Or it hurts to pick off a coffee cup, or it hurts to pick up a gallon of milk. So those are all going to be like overuse injuries of our grip muscles. And this area of our body is somewhat complicated. It's very intricate how the muscles from our elbow go into our hands, and then they have to go through our wrist as well. And if those muscles or those nerves are getting impinged to the wrist, that's called like a carpal tunnel, which is really common as well, which will generally be caused from, the most common one is like typing, computer work, those type of things as well. So sometimes they'll get numbness in their hands. Sometimes they'll have to get like a carpal tunnel surgery. They'll get that released. Sometimes they'll have it in both hands, which that generally will be coming from the spine itself, has to be coming from something more center if we see that. Having to figure out where the source of their extremity pain is a big thing, because a lot of times they can have pain in a certain part of their body, but it's actually coming from somewhere else. Trying to figure that out is usually the biggest challenge when we're doing extremities, because I could have a pain in my hands, but that doesn't necessarily mean it's coming from the hand or the wrist. It usually could be coming from the neck or the mid-back. But sometimes it is coming from like the wrist area as well. So that's what we have to figure out when we're dealing with extremities and other joints other than the spine itself.
Understood. So what role do corrective exercises play in supporting chiropractic adjustments?
Yeah, so the exercises are... Yeah, like a corrective exercise would be really important as well. Those are going to be really important when we're talking about lower extremities. This would be like our ankles and our feet. So a really common one we'll see are like plantar fasciitis, is people get pain on the bottom of their foot.
Okay. Isn't that like extremely flat feet?
Yeah, that can play a role in it. It's very similar to a tennis elbow, but to do with our foot, it's an overuse injury of the fascia in our foot. And if that gets inflamed, it causes a lot of pain, especially if you're walking long distances or anything like that. We're able to help people with that as well. Again, we have to figure out if it's coming from the foot itself. Sometimes it's coming from like the calf muscle, if the plantar fasciitis is more like in the heel, or sometimes it might be up more in the arch of our foot or in the toes itself. So trying to figure out what the source of that is generally what we have to do. But then exercises are going to be helpful with that, because we have to make sure that they're moving their foot and they're getting proper ankle mobility and foot mobility to break up those adhesions in the fascia. And then I generally have people ice their foot really good. You just get a cold bucket of water, ice and water for 10 minutes. It sucks, but it's very effective to help like that plantar fasciitis. Now, as we work our way up, you can also have a knee pain as well. And then sometimes the pain, again, is coming from the knee itself, but a lot of times those are actually coming from like your lumbar spine. So having to differentiate, like if we have a knee pain or a low back pain, is really important. And in a general case of like when it is a knee, there's 8 ways the knee can misalign. 2 are very common. So I'll see where is the pain on that person's knee, and we can adjust it into place and get it moving better. As that knee starts to move better, that can start to heal up. With the knee, though, you have to make sure the structure is intact. So if somebody has an ACL ligament injury or something like that, it's when you have to get a surgery or make sure the structure is properly intact. Now, if that is the case, then we can definitely help it out and make sure that it starts to heal and feel better overall.
So if you're saying if the root of the pain is the knee, then you'll send them to another specialist. But if the root of the pain is
so it
spine,
depends. If they're having a structural problem, so like the common one is I was playing soccer and I feel like my knee's wobbly. That's not good. You've lost the structure. So like you'll have to get that surgery corrected. But if you were playing soccer and we test your knee and you can walk on your knee, it just hurts, then we'll be able to help that for sure. So there's a structural integrity part of it. Like you have to check your PCL and your ACL ligaments to make sure those are still intact. And if those are still intact, we can definitely help it, which aren't super common. And the thing with those, they're generally not really painful a lot of times. Like you'll just have a wobbly knee. Obviously there'll be some pain involved, but compared to sometimes you can bruise your knee or it gets really inflamed. That'll actually hurt worse than like a ligament tear sometimes.
Gotcha. So can chiropractic care help prevent these types of pains from developing in active individuals in the first place?
Yes, for sure. So if you're having somebody that is an athlete, you want to make sure that the biomechanics of their spine are working properly. So if they're having limited restrictions in their pelvis or their knee or their ankle, and it's not moving properly, they're going to have a higher likelihood of injuring those areas. Sometimes those areas are hypermobile and they're moving too much. So then you need to work on things to strengthen those areas around it to make sure that the hypermobility doesn't cause any injuries as well.
All sounds good. Such informative discussion. Joint pain can feel overwhelming, but chiropractic care offers real solutions. Thank you for your insights. We'll catch you next time.
Awesome. Thank you.
Thank you for joining the Expedition Chiropractic podcast. Ready to set your spine on the right path? Visit expeditionchiropractic.com to request an appointment or call us at 772-245-7069. Here's to aligning your spine and your life. Until next time, keep moving forward.